Not everybody who has a headache has a brain aneurysm, but many people who have a brain aneurysm have a headache.
I can't tell you the number of doctors that Debbie saw with migraines, with severe headaches, with all the symptoms, high blood pressure, and not once did somebody ever mention the word, let's check and see if you have a brain aneurysm.
So welcome, everyone. I just want to say thank you all for being here to have this discussion for education and awareness for our day of engagement. It's just a nice way to have interactions with family and the physicians to, discuss what has happened, what are forward-facing things or things that'll be better in the future through this open discussion. So we can do brief introductions now. I'm going to let everybody introduce themselves. I'm Christine Buckley, Executive Director of the Brain Aneurysm Foundation, and we'll go with Dr. Aries.
I'm William Aries. I sit in the board of medical advisors of the Brain Aneurysm Foundation. I'm an endovascular neurosurgeon at NorthShore University Health System's Evanston Hospital.
Thank you. And now I'll let the Feiger family jump in.
Go in age order.
All right, so Jordan Feiger, nice to be here.
Hi, Josh Feiger.
I'm Daniel Feiger.
Jillian Feiger.
And I'm Devin Feiger.
All right, again, thanks everyone for being here. So we'll get this started. So to the Feiger family, and answer as you all want to, having lost your mom and your wife, Debbie, to a brain aneurysm rupture, and having had little to no knowledge of brain aneurysms before that, what was it like for you to hear the words brain aneurysm, and what do you wish you had known at that time?
Yeah, I can start. And for the record, we didn't pre-plan our responses, so you're getting some candid, unscripted answers here, which hopefully will be beneficial. But I think when I first heard brain aneurysm, I didn't really know what that meant, right? So I think there were two things looking back and reflecting on what I wish I had known more. First is literally, what does it mean? Like, what is physically happening in layperson terms, right? When you hear about a lot of other diseases, because there's a lot of information out there, even somebody like me who has zero medical background, you at least sort of have a very basic high level of understanding of what's physically happening to the person, right? And I remember thinking, does that mean it's a stroke? Is it a hemorrhage? Like what physically is actually happening? So that was the first thing that I was confused about and remember thinking. I think the second thing is, what are the implications of that, right? Is it, based on people's tone, right? You know that it's something serious, but you don't understand or at least I didn't understand what the implications are. Is the range of possible outcomes? Are there treatments? Are there not, right? Again, somebody tells you they have cancer, there's kind of common parlance now that even a layperson understands, or you have questions to ask. What stage is the cancer? Where is it? Has it spread? That kind of puts you in a little bit more of a box of a range of possible outcomes and treatment and process. And I had zero knowledge of that. And so I think for me, I didn't even know where to start with the questions because I just didn't have a baseline of like knowing what these words meant. I think maybe I'll put Daniel on the spot next. I think Daniel was an EMT at the time, so I think you had a little bit of a better understanding.
Yeah, I had actually recently finished an EMT course in college at that time, and to be honest, really not much more of an understanding even with that. I also, had kind of confusion and some overlap with okay, is this connected to a stroke, a hemorrhage? We knew that she was unconscious, but beyond that, really didn't understand what the broader implications are. And the actual, term aneurysm I had come across in passing was really it. More just, you see it on different TV shows or in the movies, but in actual day-to-day life, I had not come across it. Hadn't really talked to anyone that had experienced a brain aneurysm before and was not really familiar with it.
I would just say that, it's a little bit of a fog, what happened at the moment, at the time, during those days. But I do remember that every single person that I ever knew that had a brain aneurysm had died. Everybody. You never, and so the first thing you hear about is brain aneurysm. It's like, guess there's nothing to do. Not realizing that maybe there was something to do, maybe not. And also not understanding that, that people do overcome these and have aneurysms and can deal with them. I mean, that was kind of like later on, like kind of a complete shock in a way that for some people possibly, there may be treatments and that awareness might make a difference. For some people, had no idea about any of that, none.
Yeah, so for the organization, it's something that we do need to change because they can be treated. And a lot of people do feel, like you said, Jordan, that anyone that you had ever heard of before died. And it's certainly, if that's the only knowledge that you have, it's certainly not what you want to be thinking of when your loved one is in the hospital. So, following up on that, Dr. Aries, what more do you think can be done for awareness of aneurysms? And when do you think it's going to be as commonplace a term as heart attack and stroke?
Yeah, so I mean, it's a great question. I would say to the Feigers that I have taken care of hundreds of patients with ruptured brain aneurysms, and I don't think that once I have had a discussion with family and they had known what a brain aneurysm was. I think that is just it's such an uncommon disease, despite the fact that we know probably 1 in 50 people has a brain aneurysm. Not, very few of those end up rupturing, and very few people have ever known someone who's had a brain aneurysm rupture or something like that. So it is with the exception of people who have had kind of aneurysms in the family, it's unfortunately a super common occurrence that we sit down and we talk to a family about what's gone on. And you have to start from the beginning. And of course, learning about a complex medical process while you're going through a really scary situation makes it even harder. But it's incumbent upon us, I think, as medical professionals to make sure that everybody understands, and maybe not even more so patients' families, but also maybe some of our colleagues about, what to be aware of when they're dealing with somebody who can potentially have an aneurysm that's ruptured and things like that. And I think that some of the things we think about, I think we've done a really good job in explaining to people what stroke looks like. And there's a lot of overlaps between stroke and at least many of the initial presentations of ruptured brain aneurysms. So I think that going down that pathway is kind of piggybacking off of what we've done with stroke is going to be really important. But the populace is really not all that aware of brain aneurysms right now. I'm planning a talk, and I've been kind of trying to understand what people do know. And if you go on Google and look at Google Trends, and you can see when people are Googling brain aneurysm, if you look at heart attack, it's pretty much a straight line. There's a pretty common, people are Googling heart attack every day, but if you look up brain aneurysm, you see there's a bunch of spikes. And if you correlate, every spike is associated with some famous person who has had a brain aneurysm rupture. And so that's when it's immediately in people's minds. And that's, I think that's when we need to kind of, unfortunately, jump on some of that to really push our awareness. So, if you look at all these spikes and you look in the Chicago region, we've seen a White Sox pitcher a couple of years ago who had a brain aneurysm rupture in the middle of a game. Dr. Dre recently had a brain aneurysm rupture. So these are some of the more, these are the easier ways, I think, into people's consciousness is to piggyback upon some of the work we've done with stroke to understand what the symptoms are that we should be concerned about, and B, when it does happen that there's a high profile person who's had this sort of problem, we have to make sure that we use that to put the idea of brain aneurysms in the forefront of people's minds.
Thanks for that, and I do agree, but I think we're going to need the help of the medical professionals like you, because some of these meetings that I go to, I always talk about all the programs for stroke and all the awareness and education that's going towards that. And I often wonder why the hemorrhagic stroke and the aneurysms haven't been piggybacked and modeled right along with this. So I know for the organization, it's important for us to work with the medical community on that going forward. And unfortunately, too, like you said, we are in a society where celebrity has a big influence, but unfortunately, what we've seen is that the celebrities don't want to talk about it. I mean, no one really wants to say they have a brain injury because they get judged different way. I mean, I've seen it from just people in our community, just when they go back to work and things are different, or they might need more time, or they're tired, that they become judged and looked at differently, even though we can all have a day where we're tired, or we all can make a mistake or do something wrong, but someone knows you were treated for a brain aneurysm, it kind of makes people who are in the workforce and then those at a higher level not really want to be associated with being brain injured. So it's always been a little bit of a battle, because trust me, whenever there is somebody of profile that has been impacted, we try to reach out, we share their social media, but to date, no one has really come forward to wanting to share that with us. But, that's why we have to keep doing what we do organizationally, and kind of leads me into my next question with the Feigers, because they have done so much for awareness and funding for research and education. So I'm just hoping they could speak to a little bit of what they have been doing and why the education piece is so important to your family.
I can start. So first, I can just kind of go over what we've been doing. And the main way that we raise money each year is we've been putting on a softball fundraiser that kind of gets everyone in our community together to both talk about, brain aneurysm awareness and also remember our mom. So that's been a really great way to go about that. I think it's important for a couple different reasons. First, we talked about the lack of awareness. I think hand in hand with that is kind of a lack of funding, because there's no awareness. There's less funding from government, less funding from organizations, and it is all kind of tied together. So the fundraising piece is obviously important. And then the education piece is, we touched a little bit on why it's important, but I think specifically to us, it's extra important because our mom was an educator her entire life. She was, first a teacher and then a principal. So education generally just was always instilled in us and is kind of our core value.
That's great.
Yeah, I was gonna piggyback off of that also, because I was thinking the same thing, Danielle, that for me, I also am an educator and taking after our mom in that field. And so I think that education is always important, and that leads to awareness, and then hopefully will lead to funding and lead to just more people knowing how to deal with brain aneurysms when they occur, or the symptoms, to help prevent any ruptures in the future.
I think in addition to that, it's a little bit of normalizing the conversation. While we're at these events, we share memories and things like that, but we also bring up the topic of brain aneurysms as a whole. And through that, we've heard about different family friends and other people in the community who have experienced something similar that wasn't being talked about until we held an event like this.
Yeah, I think that's very true. And people do different events across the country for the organization, and there are different levels of success financially, but all of them, when some people get down, oh, we thought we'd have this number of people, or we'd raise X amount of money. And yeah, obviously that would be great if everybody did better than they thought they might. But at the end of the day, it is that awareness and the coming together of people. I was just talking with Dr. Aries, if I'll make the walk in Chicago this year, there's a lot of events that are piggybacking, including the, our research symposium. So someone from our office will be there, but all these events, when we go there, it's the stories that you hear. And like you said, Devin, people aren't talking about these experiences anywhere else unless they are part of a support group. But it is amazing in a community how many people are impacted, and it just isn't being talked about enough. So, I mean, what you do as a family, everything, supporting research, supporting some of our educational initiatives, and helping us get flyers out there, it does make a big difference. and it is critical. So I want to thank you for what you do, and just hope you know how important it is. But, you know, that's why September, it's definitely an amazing month for the folks who work at the foundation, because, you know, we get caught up in the day-to-day and you're digging, trying to get things done. But then when you put the faces to these stories that you've heard, or you hear new stories of loss, or meet a new survivor, and you realize just how important it is to keep pushing, maybe to get that celebrity to speak out, you know, someone to really bolster us to higher than where we are. So, you know, I can't thank you enough, the entire Feiger family, for all you do. And it is critical. And I am hopeful, you know, the organization has kind of grown steadily, slowly through the years. And I kind of feel we hit these plateaus, and, you know, we just have to break through again. So I'm hoping, again, 2023 will definitely be a bigger and better year. So now, Dr. Aries, I have a few questions for you, and maybe I'll read them all, break them out. But where do you think the greatest gap in education is for the medical professionals? And what do you think might be the next potential advancements in research? And how important is advocacy the Feiger family is doing for this disease? And would you encourage other families to do the same? So I think the first is the gap in medical education on brain aneurysms.
So I think that there are a couple of things that we can do better. There's a couple of things that I think we're doing really well. So the first thing is that when someone's presenting, so a family is calling EMS or something like that, and someone is demonstrating the telltale signs of an aneurysm rupture, first off is getting them to the right place, right? Because there are certain hospitals that are able to, you know, deal with some very severe neurological injuries, and there's some hospitals that are not. And so the first things first is starting education right at the, you know, the first responders, which are our EMS, some of our fire crews, people who can recognize that there are certain signs and symptoms of stroke / subarachnoid hemorrhage, that you got to get them to a comprehensive stroke center where they're going to be able to get the best care and immediately. Because just like in stroke, you know, in subarachnoid hemorrhage and ruptured brain aneurysms, time does matter, because a lot of people are having problems with hydrocephalus and things like that need to be addressed very quickly. So we start out with EMS, and we need to make sure that they know what to look for and know which people need to go to a place where they're going to get the higher level of care first. I think our emergency department doctors are great at picking up on what we consider to be kind of the classic textbook signs and symptoms of a ruptured brain aneurysm, but there are a lot of more subtle signs and symptoms that I think we can do better with making sure that people are aware of, and making sure that people feel comfortable getting a CT scan or a CTA just to rule out that something else is going on. Because I think that we are under a lot of pressure in the medical community to kind of, you know, to some extent keep medical costs down, right? And if everybody who comes in gets an MRI or a CTA or something like that, I think that it kind of sits in the back of people's heads a little bit. Do I really need to get this scan? But we need to normalize, okay, that sometimes you need to get the scan. You need to make sure that you know what's going on. And then, you know, to some extent, we have to work with our primary care doctor colleagues who are in the field, who are seeing patients, you know, more patients that I can see in a week they see in a day. And we need to, you know, clarify for them, hey, what are some of the signs and symptoms that you should be worried about? Something that could be going on that may be indicative of there being a change or something you should be worried about. Or also, who should get some screening? What people who have had a family member who's had a ruptured aneurysm, certain people with certain diseases should get some screening to make sure they know what's going on. But I think that the most important thing we can do, and this ties in a little bit with the discussion that we have about research and about funding, is that, you know, what we need something that is a little bit better of a screening test to look to see if we can find people with brain aneurysms, because we don't have one right now. And we can't roll every person who gets seen in a primary care doctor through an MRI or through a CT scan. So we really need the funding, and we really need to get over this hump of finding a less invasive or even non-invasive way of a high fidelity way of screening for people with brain aneurysms, at least in people who are of or in a higher risk. So that is why we need families like the Feigers who are there and who are supporting research, and who are supporting things like Brain Aneurysm Foundation, and also advocating for research funding, because that is hugely important. We know that the US government spends about $2 on each person who has a brain aneurysm a year, which is just, compare it to other diseases, it's not nearly enough that we need to get this good research done, and which is why having families like yours who are supporting the Brain Aneurysm Foundation, who are raising awareness, who are pushing for that funding, is just absolutely important.
Thank you. And Dr. Aries, I just want to ask what you think the role of artificial intelligence will be in detecting and help training and treating brain aneurysms.
So artificial intelligence will probably cross our path in a number of different ways. One way that it's going to happen is through at the point of when someone's kind of presenting with a brain aneurysm. So a lot of times we are getting a CT scan in the emergency department, and the emergency department doctors aren't quite well versed in reading a CT scan, and maybe they could miss something that's on it. But we know that at least in stroke and in certain other diseases, we're starting to use artificial intelligence to be able to run through these CT scans with high fidelity and very quickly, and alert us for abnormalities. And so we know that some of the programs that we're using are doing detection of blood on CT scans, detection of aneurysms on CT scans, so really important stuff like that. And then the next will be, I think it's further down the line, but so what you need to have is you need to have an understanding. I mean, optimally, you have a blood test, right? And then what we'll need to do is we'll need to have some deep learning AI protocols that are going to be able to go through, hundreds of thousands of millions of blood samples and find ways to identify markers for aneurysms in the public. But that has to be done with really high fidelity, and make sure we're not having, misses, also so missing people who have a brain aneurysm, and also having false positives that lead to people getting more testing that they don't need. And that's something that I hope is down the line. I know there's a lot of people doing a lot of research and trying to find something like that, because that's really ultimately going to be the way that we're going to save people's lives.
Thank you for that, Dr. Aries. Now, I open it up to the Feigers. I mean, I hope all of you can at least ask Dr. Aries one question of something, anything brain aneurysm that's kind of stuck with you that no one's ever clarified, or anything with family history or whatever it might be. So I open it up to the Feigers to ask away.
I think that,
in the neurosurgery boards, there's only 3 people who are grilling you. So this is even harder than the neurosurgery boards right now.
I think for me, one thing that I always think of when I think of any disease is like, what are the genetics to it? And are people who are related to somebody who has a brain aneurysm more predisposed to be having one themselves? And I think that's something that, as our mom died of a brain aneurysm, like, is that something that we should be extra cautious of, or how do we look out for that? And what should we know?
So we know that there is a very small subset of people with brain aneurysms that run in families. And we see that. We typically don't end up recommending screening for family members with someone who has had a brain aneurysm, unless there's been more than one person in the family with a brain aneurysm. So now I think that is always a catch-22. Well, how do you know there's not somebody else in the family who has a brain aneurysm unless you screen them? And so I'm pretty liberal with my screening for this, because I think that getting an MRI for a screening test is a very safe thing to do. And I think that ultimately, if it helps you sleep a little bit easier at night, that's okay too. But also, if we find something, well, then at least we can watch it. It doesn't mean if you find a brain aneurysm that you're going to recommend fixing a brain aneurysm. We know that there are certain ones that are riskier, and there's certain ones that are very likely to be benign. But at least having that imaging, having that knowledge, and being able to have that conversation with a physician who treats these is going to be important. So, would I tell anybody in the general public to just run out and get a brain MRI? No. But if you've had a family member who's had a ruptured brain aneurysm, I have a pretty low suspicion to just get an MRI, because I think that the chances of hurting you doing an MRI is exceptionally low. And I think that if we find something, we can come up with a plan together about what we would do about it.
Okay, that's helpful. That's great. I have a question. So I'm curious from your perspective, what I feel like we, obviously being involved with the Brain Aneurysm Foundation, and we've all done a lot of work to try and educate ourselves over the last decade or so. And you see a lot of incremental progress, which is always important and good to see. I'm curious from your perspective, and we talked a little bit about like the AI and what maybe is on the forefront, but I'm curious from your perspective, if there have been any like critical or key breakthroughs, either in information or technology recently, and if you feel like there are any that any potential breakthroughs that seem to be potentially on the horizon that could really change the game in the somewhat near-term future, 3, 5, 7 years, and what that would look like.
The unfortunate answer is that there's not a lot that we have right now, and that could be secondary to a lack of funding. Okay, there's just not enough money out there to get the research done that needs to happen. To some extent, it's probably because if you compare brain aneurysms, something like heart attacks, okay, it's just the number of people who are affected by it in a given year. While it may affect the funding, but it also affects the ability to identify that sort of research, identify blood biomarkers and things like that. But I'll be honest, the more funding you get, the more you find your ability to be able to do this research and get it done, to work with smaller amounts of people. So, we haven't seen a lot of progress. So where we've seen a lot of progress, unfortunately, is we've seen not on the front end, so identification, but I think we've seen a lot of progress in how we're able to fix brain aneurysms, or how we're able to, both people who have ruptured brain aneurysms and both people who have identified unruptured brain aneurysms. I think that we have found increasingly less invasive and more patient focused ways of being able to fix these brain aneurysms in safe and ways that we can protect people from having a bleeding event. But I think what we all want, and I think what you're asking about, Josh, is that have we found a way, have we made some progress in identifying, brain aneurysm, other than that we happen to get an MRI for some other reason and find it? And the answer is we have not been making a ton of progress on that. But I think as we start having faster, cheaper ways to look at human genetics, we're going to be able to identify that a little bit easier. And having people who are just pushing for that funding and that identification is going to be really important.
Thank you. I'm kind of curious about how things within the education system have changed in terms of looking into brain aneurysms, well, through doctors and nurses and kind of EMS you talked about a little bit earlier. How has that been presented to them to make that change?
I think that the education I don't think there's been many big changes in terms of education. I think where we're seeing the most education and the best advances in that is in hospitals where we're dealing with patients who have had brain aneurysms rupture. I think that our patient care around that has gotten a lot better, and I think our understanding of how to care for these patients keeps increasing every year. And I think that we used to tell people that when you had a brain aneurysm rupture, there's probably about a 50% chance of you not making it. And I think that number is slowly, but incrementally getting better because of advances in patient care. And that's a part of education. This is how to take care of a patient who's, profoundly medically sick, probably the sickest patients that neurosurgeons deal with. And I think that we are getting better and better at learning how what the eccentricities are of dealing with a patient with a ruptured brain aneurysm and how to better care for them. Because I think our survival rates are getting better, although they're still sadly not where we want them to be. But we're getting better and better every year at taking care of these pretty significantly ill patients.
And I would just like to add to that, I mentioned to the Feiger family that Dr. Aries, you are going to be giving a Pri-Med lecture to the primary care community. I believe it's in October in the Chicago area. And again, this will be the first time that he's presenting, but I think he's going to see, I've sent him some of the feedback in the past, but you'd be amazed at how receptive this community is to kind of get a refresher of something they really haven't thought about that long ago, or even thought, because again, their primary care, like you said, they're seeing so many people. And certainly for sure, everyone that has a headache doesn't have an aneurysm, but it is also listening to that patient to think twice if it's someone that's like, I've never had a headache, I have a pain in my neck, I just haven't felt like myself, to make that provider just to think twice. So I think you're really going to see the impact of that lecture. And that's another thing that we do throughout the year. And I think it is critical. Again, it's slow, but it's breaking down a little bit into that community. So the more we do it, I think it'll be certainly helpful.
Yeah, and my question kind of ties into the last point about, survival rates. And like we discussed early on, when we first heard the term aneurysm, your mind kind of goes to, okay, there's nothing to do here. That's the end of the road. And when we start putting actual numbers and percentages to things, that's helpful. So I'm just wondering if you can kind of give an overview and understanding these might be estimates, but what percentage of people do we think have an unruptured brain aneurysm? What percent of those are going to ultimately rupture? And then what percent of the ruptured brain aneurysms have various results?
Yeah, so I think that the data would suggest that it probably about 1 in 50 people may have a brain aneurysm, which is a shockingly large number. But when you think about it, the risk of rupture, I think, is something on the range of 1 in 10,000 or something like that. It's a fairly low number, which is good, because I can tell you the majority of patients that I follow who have brain aneurysms, they're all very small brain aneurysms. They haven't changed. And so that's okay. It's great that they're identified, and it's great that we can follow them. And the likelihood of them having a bleeding event, we tell people who have a small brain aneurysm that the chance of them having a bleeding event from it is probably about 1% over 5 years. Okay, so very, very low. When we think about a brain aneurysm that ruptures, the rough numbers that I talk to patients about when I have a conversation with a patient's family who has had a brain aneurysm rupture, or a patient who were worried about it rupturing, we think about that when a patient has a brain aneurysm, about something on the range of a third of patients can die before they get to medical attention. Which is a pretty significant finding. That's something that far exceeds people who are having strokes, people who are having heart attacks, and things like that. Of the people who do make it to medical attention, something probably on the range of a third to half of them may actually die in the hospital. Okay, and then of those people who do survive, we think about half of people who survive have ongoing neurological problems, and that can be fairly minor. Okay, people can go back to work, but they're a little bit slower, like Christine was talking about, that they struggle a little bit, but they can go back to work, and that can be very functional. Okay, and then there can be people who can have pretty devastating brain injuries but have survived. That's kind of the numbers that I cite to people. Of course, because the number of people who have ruptured aneurysm is pretty small, you can't ever know really for sure, but that's on the range of the statistics that I cite to people.
All right, I guess I'm last. So, well, first, Dr. Reyes, I'm feeling like inspired that there are people like you out there, like clearly going to make a difference, because I can't tell you the number of doctors that that Debbie saw with migraines, with severe headaches, with all the symptoms, high blood pressure, and neurologists and other cardiologists and internists. And not once did somebody ever mention the word, let's check and see if you have a brain aneurysm. So I think the work that you're doing is going to make a huge difference, and others like you, and obviously the Brain Aneurysm Foundation, in conjunction, is going to make a big difference. So with that, I guess I'm curious as to, in the near future, let's say 5 to 10 years, like, what is your hope relative to the world of kind of, I would say, basic medicine, for patients that come in with symptoms, and doctors, the various versions of the medical profession that sees patients, kind of what is your hope in terms of, how often is, I guess not how often is, but, kind of what's the trajectory? What would be the normal path that patients and doctors would have to try and avoid the maximum number of ruptured brain aneurysms? You know, how do you kind of see this playing out over time in terms of your vision?
Yeah, I mean, if you look at the basic science research that exists right now, I don't know if we're talking on 5 to 10 years, but I do think that in our lifetimes we will find some sort of biomarkers for either a threatened brain aneurysm or even the presence of a brain aneurysm. There's been a lot of people who have been doing a lot of research and looking to see, are there circulating biomarkers in the blood that maybe, you know, if you do a blood test and you say, oh boy, this is a little bit higher than we usually see it, here's a person who may be at risk of having a brain aneurysm or changing brain aneurysm. And I know for a fact that this research is going on. So do I think that we're going to have a blood test that, you know, you can go into your local lab and just get a blood drawn and says, oh, you have a brain aneurysm? I don't think that that's in the 5 to 10 year time frame, but I do think that I know that there are some people who are working on identification of changing processes. So some of the biomarkers that may indicate that there is changing tissues associated with a brain aneurysm, and that may be helpful for patients who, because not everybody who has a headache has a brain aneurysm, but many people who have a brain aneurysm have a headache. And so to be able to tie those two together, to be able to say, here's this population of patients who may be at a little bit higher risk. They've got headaches we can't explain. They've got, funny findings with their eyes, something like that. Well, can we do some sort of screening test that can identify them? And I think that that's a reasonable expectation, a 5 to 10 year horizon, maybe to be able to have something like that. But also in that 5 to 10 year horizon, I think it's very easy to empower people to just get some imaging, okay? Because that's the easiest thing we can do. And that's the easiest thing we can identify is just having people just, hey, I have this suspicion, we're just gonna do this test and we're just gonna make sure that there's not something going on. Because that's the way we have right now of identifying a brain aneurysm. So realistically, if we have a patient who has some legitimate complaints, well, then we should at the very least do well enough with our education that our primary care doctors or ED doctors, our neurologists are just getting a scan, just making sure that they're not missing something. Because the cost of missing something is so profoundly high, whereas the cost of doing something is not that high at all.
And on that too, I kind of have another question or comment with the cost. I know that there are some physicians working on developing a screening protocol like you do for breast cancer or colon cancer, and they're looking at the ages, for particularly first for women, the average age 35 to 60. Women are more likely to have an aneurysm rupture more than men. The risk factors of smoking and high blood pressure. So I know there are people looking at that, and particularly with the smoking piece. And with that, they're trying to get the data to say, if you do the scan, say for somebody that presents with the symptoms with those risk factors within that age, you get the scan, it is cheaper to do the scan to find an aneurysm, again, in this population of patients versus letting a rupture occur and then the treatment and the rehab and everything that person might need down the road. So Dr. Aries, have you heard of that, or do you think that will ever come to fruition either? I don't think it's in that 5 to 10 year, but maybe a little later.
Yeah, I think in the era of big data that we're living in, where we have all this information, I think that we should be able to tie together a group of people who we really feel like should be part of a screening protocol. But unfortunately, that it takes time and it takes numbers to put people together. And the unfortunate part is that means during that time, some of those numbers are people who are going to have aneurysms rupture. But what we do know is we do know, and maybe we don't do a good enough job at it, but we know what some of the risk factors are. And I say them every day, 5 times a day in clinic when I talk to people about it. I talk about blood pressure, I talk about smoking, I talk about family history. And so it would behoove us to make sure that our primary care doctors, when they are taking their family histories and they're asking people about things, when they identify something like that, oh, you had a mom who had a brain aneurysm, oh, you smoke, oh, you have uncontrolled hypertension. These are people who probably would fit into that criteria that you're talking about, Christine, that in the long run, it may be, and unfortunately we have to talk about things like this, but it may be more financially feasible to do a screening test for them as opposed to the healthcare costs associated with someone who's had a ruptured brain aneurysm, which is when you have to think about that, a profound cost to the healthcare system. It's a profound cost to a person, okay, and their ability to earn in the future, and also, outside of the monetary costs, it's just a profound personal, devastating toll on both the patient and the family who has to go through it.
No, I was just going to say thank you so much. This has been definitely a learning experience for me. So hopefully it's been helpful for everyone else as well.
Yeah, and if I could just ask before any other final thank yous and goodbyes, if people could put in, a little shout out for the day of engagement and why people should, support in some way, whether it's just sharing information on social media or making a donation or helping spread awareness, that would be great.
Yeah, definitely. Look, I think there's some low-hanging fruit here, and I feel like in terms of organizations and diseases where there's a very easy way, whether it's a relatively low amount of dollars or just information sharing, to make an incredibly tangible impact in a way that there's a lot of important causes out there, but a lot of them have a lot of attention and a lot of funding, and it's hard for one person or a small group of people to make an impact. And I think this happens to be an issue where a very small group of people and relatively low dollars can make a huge impact and go a really long way. And so I know that's something that obviously we have the personal connection, but it's also really drawn us to this organization and this cause, because it does feel like there's a real impact to be made fairly easily.
I just want to say thank you to the Feiger family, honestly, for all that you do, and being able to take something that tragically impacted your family and turn it around into something to help others in the future. I mean, it is amazing, and I know it's hard to do, and it's hard to relive it, and it's hard to talk about it. So I just want to thank you for the great strides that you have made and your support. It has been amazing. And Dr. Aries, again, thank you for your time and always being willing to share, to educate, to raise the awareness, and to give your time to talk to families. It really is meaningful as well. So thank you so much to everybody.
Yeah, thank you for having me, and thank you guys for sharing. I can't imagine how hard this is for you to kind of think about this, but I'm sure your mom and your wife would just be so proud of you for what you're doing and trying to help other people so they don't have to go through what you guys went through.